Nurses who care for many of Colorado's veterans are now raising alarms over recent changes from the top. They say some major adjustments at Rocky Mountain Regional VA Medical Center happened without nurse or union input, and some will impact patient safety. It comes at a time when hospital staff across the state is stretched thin because of COVID. 36% of facilities are expecting staff shortages within next week. More than 1,500 people are currently hospitalized in Colorado, and 47% of critical care ventilators are in use. Connor McHugh is live outside Rocky Mountain Regional VA Medical Center for us tonight. And Connor, some nurses felt so strongly about these staffing changes that they staged a protest.
Yeah, last night they held a rally right outside of the hospital and waved signs and shared why they believe these recent moves by management at the VA will both hurt the staff here as well as the patients. And tonight, while it is much more quiet, they say these issues and concerns remain and they want them addressed.
Frustration is boiling over for the nurses at Rocky Mountain Regional VA Medical Center. And this is how they showed it Friday night.
They need to listen to us and they need to work with us. We want what's best for our veterans.
Among the nurses' concerns is patient safety. They say short staffing and a shift change decided without union input will stretch nurses thinner.
What that means is I can no longer bathe my patients. I don't have time for that. I can no longer do oral care.
Nurse and Iraq War vet Becky Chandler fears it will also drive staff away.
We will lose nurses that are going to be forced between their personal lives and their careers.
Our staffing ratios actually exceed the private sector standards.
Michael Kilmer is the hospital's director. He says the new two-shift model is the community standard and an improvement from before.
We have so many shift changes, the inpatient units aren't ready to receive those patients. And that causes a patient backup and potentially patient harm.
Nurses disagree.
They don't cry with the veterans. They don't hold their hands as they take their last breath. They don't understand what we do, and they are making decisions that will affect what we do.
Now, nurses also told stories of intimidation for speaking out by managers, which they say denies them their collectively bargained rights. The director here at the VA says he has heard those concerns and they will take action if they continue. Live tonight in Aurora, Connor McHugh covering Colorado First.